students, myself Dr. Swathi KS, Assistant Professor, Department of Rashastra and Vaishishya Kalpana, Jayoti Vidyapeeth Women's University, Jaipur. So today we'll be regarding the topic of the routes of the drug administration. So coming to the introduction, the route of drug administration, it is an important factor which influences the absorption of the drug. The interval between the administration and onset of the action, so it is determined by the route of this drug administration. So coming to the route of drug administration, it is of three types like enteral route, parenteral route, as well as the topical route. So coming to the enteral route, so it is again divided into four types. So that is oral route, rectal, buccal cavity, and sublingual route. So coming to the oral route of drug administration. So oral refers to the two methods of administration. So applying topically to the mouth as well as the swallowing for absorption along with the GI tract, that is gastrointestinal tract, into the systemic circulation. So PO, which is from the Latin word OS, means perorally, is the abbreviation used to indicate the oral route of the medicine administration. The advantages of the oral route. So coming to the advantages is it is convenient. So like can be self-administered and it is pain-free and easy to take orally. Next, absorption. Coming to the absorption part, the absorption takes place along with the whole length of the GI tract, and it is cheap also. It is cheap when compared to the most other parenteral routes. So disadvantages of the oral route of administration is that so it is like inefficient. So only part of the drug may be absorbed, and irritant and unpalatable drugs cannot be administered by this route. So first part effect, like drugs absorbed orally, so it will be initially transferred to the liver. First it goes to the liver via the portal vein. So there it goes, and this route may not be useful in the presence in case if the patient is having vomiting or diarrhea. So this route is usually not preferred. So the route cannot be administered in case of the patient is unconscious or in case the patient is uncooperative. And destruction of the drugs by the gastric acid and digestive juices also happens, and effect is too slow. So in case of emergencies, we can't give this oral route of the drugs. We can't give. So what is the first pass effect? So the first pass effect is a term used for hepatic metabolism of a pharmacological agent. So when it is absorbed from the gut and delivered to the liver via the portal circulation, so the greater the first part effect, the less the agent will reach to the systemic circulation when the agent is administered orally. So the common dose which are given in oral route of administrations are tablets, capsules, powders, liquids, any solutions, suspensions, syrups, elixirs, etc. are given in the oral route of administration. So coming to the first one, the sublingual route. So sublingual administration is where the dosage form is placed under the tongue and rapidly absorbed by the sublingual mucosa. The advantages of the sublingual route is that it is economical and quick termination, and first part effect is not done here, so it will not undergo first part. It is avoided here, and the drug absorption is quick and as well as rapid. The disadvantages of this route is unpalatable and bitter drugs cannot be given by this route, and irritation to the oral mucosa may happen, and large quantities are not given, and few drugs are only absorbed by this route. The next, buccal route. The buccal administration is where the dosage form is placed between the gums and inner lining of the cheek, that is buccal pouch. so absorbed by the buccal mucosa. The advantages of this route is here first part effect will not be there, and rapid absorption is there, and drugs are stability. Disadvantages of this route, so it is inconvenience, and advantages lost if swallowed. So here the drug what we are giving it should not be swallowed, and small dose limit only we can. So next is the rectal route. So administering the medicines to the rectal route by the help of the suppositories or enema. So advantages of this route is used in unconscious, can be given in the unconscious patients, and also in the small children also can be given. So useful in case if the patient is having nausea and vomiting also in that conditions, this route is preferred. So disadvantages of this route is, so it is inconvenient, and absorption is slow and erratic. So irritation or inflammation of the rectal mucosa can happen. So this is regarding the today's topic, routes of drug administration. So if any queries, please mention in the comment box so that I can resolve it. Thank you.